I was just wondering when you would do that because I progressively saw your voice getting strained there. But we appreciate you being here in spite of your. Edna is a true leader. She and a woman of faith. She truly exemplifies that in all that she does. In spite of some challenges, she's still here looking like a leader and handling that role very well. Well, it's my pleasure to this morning just share with you a little bit about HCF and what is HCF. I'm going to share my screen with you all at this time. There you go. I believe you can see the screen. HCF is an interdisciplinary, our motto, our goal as HCF is reaching the sick in Jesus' name. We're an interdisciplinary, international, interdenominational followers of Christ that are present in over 120 countries, but in the USA since 1972, based in Benoni, South Africa. Now, the history of HCF was started by two brothers, Carl and Francis Green, during the terminal illness of their father in 1936, as they were visiting him in hospital and, taking care of him at that time. They observed just the need that existed in hospitals, especially in the area of spiritual needs. They recognized that Christian healthcare workers occupied a key position to express Christ's love and his message to those in their care. And interestingly, one of the things they observed that more people pass through hospitals in a year than pass through churches. There are more people in hospitals than are in churches. We have some big mega churches in America and there are churches all over the world, but there are more people that pass through the wards and corridors of hospitals yearly than they do churches. And so healthcare workers occupy a key position in providing the compassion of Jesus Christ to such people. So the vision of HCF International was to strive to inspire and equip all Christians serving in healthcare to manifest Jesus Christ in their daily life and work. I remember what one of our conference speakers last year said. His name escapes me. He says, when you wake up every morning and your feet hit the floor, you are on mission. And so for a lot of these healthcare workers, the hospital where they spend many hours of their lives is their mission field. And so want to make sure that to inspire and equip them to serve and manifest Christ in their daily life. The ways we do that is by implementing Christ's Great Commission within the healthcare field, going into all the world and making disciples, preaching the gospel, and demonstrating the power of Jesus Christ in his name. That is the vision of HCF. The core truths that we engender, like I said earlier, is more people pass through the healthcare facilities of the world than through its churches. And children, whether they're children, adults, relatives, and other visitors, they are in need of the patient's peace of mind and their spiritual health. They contribute greatly towards their physical recuperation and total health. And the ministry of Jesus Christ was directed to the whole man's body, soul, and spirit. And Christian healthcare workers have spiritual authority and responsibility over their places of work. The way I like to see that is this: there are more people, there are people that healthcare workers have access to and authority over than pastors do. Thank God for pastors and what they do, but thank God for healthcare workers that have authority in their workplace to be the hands and feet of Jesus in those places to minister to those that are in need. Also, and importantly, one of the things I want to mention about HCF, borrowing from the experience of my good friend, Dr. Edokun, is that HCF also provides for the spiritual, in many cases, the spiritual growth of a lot of healthcare workers. There are many doctors, nurses, healthcare workers that HCF has been there, a lifeline for them in their walk with God and their growth in the knowledge and the things of God. So that's worthy of note also. We don't exist in isolation. We have many partnerships with different organizations that come alongside HCF, or that HCF has come alongside to further the cause of God's kingdom in the world and in America especially. Some of them are listed here. We have Oasis Fellowship here in Houston, Christian Medical and Dental Association, IHL's Global, EMAS in Canada, Global, CHE Network, the Cardia Foundation, Ukraine Medical Outreach, Medical Ambassadors of Canada Association, Nurses Christian Fellowship International. And these all, at some point or the other, have worked hand in hand with HCF to further its cause and vision, and participated in past conferences. And it's been a pleasure working with these organizations. How can you get involved? The involvement in HCF is by prayer. As you've observed today, prayer is a major part of Healthcare Christian Fellowship. We believe that the organization has grown and spread to as many nations as it has, and had the impact that it's had because one of the main reasons because of prayer. And we try to engender that in all those that participate in HCF, whether it's individual, to encourage their individual prayer lives, but also encourage them to pray in groups, or form prayer groups in each healthcare unit or institution where people come together and pray and release the authority and power of Jesus Christ over their sphere of influence. Also, there's discipleship. There's integral disciple making. HCF is committed to helping to make disciples of these healthcare workers in their different workplaces. They have different discipleship training opportunities that take place. There's training in evangelism and being a witness. They have a fantastic training program called the Saving Process that just trains healthcare workers how to be salt and light in their workplace. Also get involved in medical outreaches and missions in different parts of the world. How can you support the ministry and vision of HCF? It can help spread the compassionate message of Christ to healthcare professionals by, I don't want that to go away. I want to bring that last slide back. By donating to the Healthcare Christian Fellowship. Your donations help to spread that compassionate message. Now, this is something that, I want to just encourage us to pray about and consider doing, to donate to HCF USA. I am not bashful about asking people to donate. The gospel is free, but getting the word out costs money. And so we encourage you, as you pray about it, if the Lord lays on your heart to donate to HCF, or people that might be in a position to donate significantly to the cause of HCF, will welcome that. You can go to hcfusa.org, #donations, and be a blessing that way. And so that's just a nutshell about HCF. We welcome, perchance you are not part of that organization. There are chapters in different parts of the world. You can get plugged in and be part of this mission and vision of spreading the message of Christ to the nation of the world, to the healthcare workers in different nations.